Hello, everybody, and welcome to the next episode of our webinar series. Today is a very, very special one because we are fully corona-proof, but we are at a location. We are at the Military Rehab Center in Doorn, where we will show today a live demo of the computer-assisted rehabilitation environment, a system used to boost human movement research and clinical rehabilitation. Let me first start with introducing the crew here today. We have Merel Trossel, who was the organizer. She's a product manager for Caren and Grill at Motec Medical, and she will also be our test subject today. The presenter, speaker, and host today is Dr. Maarten Prins, physical therapist, human movement scientist, and he's an expert on the use of advanced rehabilitation technology for both human performance research and clinical rehabilitation. And I myself, I'm Frans Steenbrink. I will be moderating today's session, and I'm responsible for market development at Motec. So the webinar will be approximately 1 hour. We have 15 minutes of questions. All of your microphones are muted, but you can, during the webinar, ask your questions in the question box, which you see highlighted here on the screen. And we will try to answer as many questions as possible during the webinar. At the end of the webinar, I will also pose some of the questions to Maarten, and otherwise we will answer after the webinar. So let me start with a very brief introduction. So in everyday life, we are not aware of our balance, our locomotion, our motions, or our mobility, unless there is a moment in life when we lose these functions, which are otherwise considered to be natural and normal, and we don't take any attention to them. As we all know, we are living in an aging society, and although it's really good that we all grow older and older, but unfortunately, aging can come with many problems in terms of locomotion, for example, due to stroke, orthopedic disorders, or other injury or traumas. The currently available assessments and interventions that are used in daily clinical practice, rehabilitation, physical therapy, are unfortunately very often not sensitive nor effective enough to accomplish good rehabilitation outcomes. And as we have seen over the years, there has been a great technological revolution in many, many fields. This is just an example for gaming, where we see that the technology has improved tremendously. And of course, we know also that in rehabilitation and physical therapy, we have learned a lot about how to assess and how to treat patients with locomotor disorders. And the big question is now, how can we bridge between this clinical knowledge, this scientific knowledge on the best effect sizes and the best assessments to treat patients, using advanced technology to enhance the rehabilitation and the research. And for that, today, we are very, very pleased, and it's a great honor to be the guest in the Military Rehab Center Aardenburg in Doorn, in the middle of the Netherlands. And it's a great pleasure to give now the word to our host, Maarten Prins.
Yes. So thank you, Frans. Before I start my talk, maybe we can get a quick overview of the room we are sitting in, so you know where I'm sitting relative to the system. So there is the Caren system, and there you see me. So you have a bit of perspective for the rest of the webinar. So welcome again to the Military Rehabilitation Center. In a minute, I will tell you a bit more about how we use the Caren system in our facility. There we go. I would like to start to tell you a bit about the Caren system itself and how we use it. Frans, before I continue, can you maybe mute the headset for a second? Or okay, thanks. So the Caren system you see on the screen consists of several hardware components. We have a platform, and a patient or participant in a research study is standing on top of that platform, and that platform is on top of a motion base. So there are pistons underneath the platform that allow us to move that platform in all possible directions. So it can translate to left, right, up, down, forward and backward, but can also rotate in all possible directions. And as you can see on the platform, there's also a treadmill integrated. So we can also make a subject walk through a virtual environment. In front of the platform, there is a cylindrical screen. It is 180 degrees round. And on that screen, we can project any virtual environment we like. So you can walk through a forest, for instance, or sail over an ocean. Anything you can think of, you can build it and project it on the screen. While someone is standing on the platform, there are also several aspects that we can measure. Underneath the screen, you see two bit dimmed lights. Those are actually motion capture cameras, and there are in total 10 cameras hanging around the platform, and using these cameras we can register the movement of the subject on the platform. Under the treadmill, there are also force plates. We can use those to measure the amount of force that the person is exerting on the ground, and with all that information combined, the and also calculate how force someone is exerting in his ankle or knee or hip joint, for instance. And what we try to do is we try to use this equipment to get as much added value for our therapy, for our patients, but also to answer unique scientific research questions. So first, I'd like to tell you a little bit about our treatments.